Good morning to all. Welcome to our podcast. Today we will be talking on a very important yet many don't discuss this topic regularly. So it is the financial burden in the case of patient care, dental care mainly. So we will explore the things like who is most affected, how dentists play a role in discussing the finance with the patient, and how the policymakers and we as a dentist can develop it. So here we have with us Dr. Saubhagyakar, who will be with us discussing this topic in a broad aspect. Let's start with the podcast. So good morning, sir. Good morning. So, how's the clinic going on and how's the practice going on nowadays? It's all good. If Yes. you can manage to do things in a better way, Yeah. things goes good. Okay. The thing is that you have to do your treatment and holistically earn so that you can feed your clinic and feed yourself. The 2% scenario. So, starting with word feeding, I will be asking you what you mean by financial burden in respect of dental care and in the world of dentistry. The burden is on the dentist or the patient. There are two things. Both. Both. Okay, if I take into consideration the fact that the burden, first of all, I will talk about the burden on the dentist first. You know what? When a dentist just passes BDS or MDS graduation and all, or any other supplementary additional qualification he does, Yes. he loves to open a clinic. And that's not an overhead affair, but he has to do it in overnight way. For that, he needs a capital, a baseline capital, and a calculated risk. Which is increasing in nowadays. I can see that clinics. From supply perspective, we can see that the competitive edge over the materials which is being, uh, the materials which is being mostly invested in a clinic. That is more important than the technology, which is again non-affordable by the dentist sometimes. I feel so. And how it is affecting the patient, like from your perspective? If the clinic runs in a fees for service treatment, so we have to calculate, and as per the financial institution to give us the machine or the cash we invest in the machine, there is an equation. That is the return on investment. We have to calculate the return of investment in lieu of the service we provide. Yes. So of course it will affect the dentist in the sense we have to take the charges, withholding this concept of machining and ultra diagnostics for the patient. It will help the patient ultimately. But of course, there will be a cost factor for the patient. That is a fact. We cannot just say that no, we are going to take the same consultation and give you the diagnostics. The diagnostic what the dentist is having and trying to procure that in the clinic as in-house, Yeah. has to be resolved at the level of financial inclusivity. So, in the line of patient, I would ask, like, have you noticed or have you experienced like patient are delaying their treatment or not coming to the dental clinics because they feel it's a very heavy, cost is very not affordable for them, and for that is a but that is like a drawback or like barrier for accessing the dental care by the patient. So I think your question is directed towards the fees that we charge and the willingness of the patient to pay us. Is it Yes. so, or the non-capacity of the patient in paying for the treatment? Exactly. Can I be more accurate in that? Not non-capacity, like yes, the fees and the charges See, and right, the point from absolutely correct. And but I'll tell you one point. I'll tell you one point in this concept that whenever whenever we are going to take charge from the patient for doing the treatment, this is of course a cost benefit to the patient. Yes. I'll be stressing on the fact what is cost benefit. It's like suppose anyone is having a cavity and we are doing a restoration Yes. or a filling. Yeah. That doesn't mean that we have charged for the restoration. Is the money the being charged for the filling? I just take it as a composite value. What is the composite value for this? That the money what we're charging for the restoration is what the matter and the service charge that the healthcare provider are taking. Yes. But what the output actually. The output should be in the years of life, in the quality of life that the patient achieves after undergoing a procedure known as restoration. The normal filling inside the cavity. It is very important. Yeah. Because
So my next question in this direction will be like, is do you think delayed treatment or patient not coming to the clinic at the right time, does it affect the financial burden of the patient? Like I think if a small cavity is there, like if they come to the clinic and prevent it, the cost will be more accessible than having a bigger root canal treatment and provide and giving more payment to the dentist or the
see,
clinic.
to be very frank, actually, like it is for all clinicians and whosoever is listening to this, treatment is not a standalone property of a dental clinic or institution.
Yeah.
Something has to be done at the grassroots level also.
Yes.
So there are levels of healthcare.
Yes.
When the patient is approaching us, they should have in their mind that what is the level of healthcare we are providing to him or her.
Yes.
And that is directly proportional to the degree of damage to the tooth.
Yeah.
If they come for a checkup, we can go for preventive treatments like pretension sealants and all.
Yes.
If they come for minor caries, we can go for restorations and PRR. And if they are having some pain or infection, we have got various indices in the clinic,
Yeah.
which we can check it out and treat it in
Yes.
that way. So gradually it depends on exactly the motivational level of the patient, the access to us, and of course, what is the ground level scenario of our place where we stay.
Yes.
Now, in the ground level scenario, there are many level providers, like mid-level providers, those who really work and do awareness of the patient.
Yeah.
There are many social media campaigns done by the many dentists in the private level.
Yes.
I mean, the government is doing great in
Camps
implementing the camps and doing a lot of
awareness
programs and all
campaigns.
this. So it is of course a shared responsibility between the organizations and between us. So we as a clinicians, as a dental clinic owner, we know when the patient will come to us, we'll be surely giving them the then cross-sectional treatment, what is the problem they are reporting to us. And of course, we should look into the budget. The more the awareness of the patient, the less
the budget
is
will be.
what they are going to expect.
Right. Yes.
It's actually the thing is that the healthcare budget is not the expense. It's the expense and the saving and the quality of life what they're getting. The investment is important, not the exactly it's not the expense.
Yes.
Or we cannot calculate as a budget actually.
Yes.
That's the point
That's the
what we
point.
need to do.
Yes. So how do you think the out-of-pocket payment, dental insurance, and government-funded dental services influence access to dental care?
See, my answer will be little bit skewed. So the concept is very simple here. That is there a health insurance in India? Second question, I shouldn't ask you a question, but the question what comes to mind before answering, is there any health insurance in India for dental patients? So there is a striking difference between these two questions when the word dental comes.
Yes.
It is coming under a category of cosmetics earlier.
Yes.
So insurance is not covered. I mean, it is not covered in slab of insurance. But there is always a constant factor in human mind that is a budget of the expenditure. Now, we can see that health insurance has magnificently increased in the medical side.
Yes.
And we know that medical expense earlier, what used to happen for the patient who just goes to outdoor or get admitted in a hospital for a deadly cause or any other
But that
disease.
is insurance.
So there was no insurance earlier. Now there is insurance, and the cost is very much minimal. So they can shift the slab of expenditure to the dental point of view if at all we aware them in regular basis. And that way, the health insurance model is better for the dentist. We cannot say like why there is no insurance in dentistry. That's again a policy level decision. That's again a baseline data analysis. But if we know that there are some medical conditions in which insurance is valid and there is a shared etiology, for example, diabetes and oral health, So it's sure that in diabetes, 90% of the insurance is covered
So,
for the patient, and it's
yeah.
only the dental part what we are just going to plan it.
Yeah.
And that way we can feel that in dentistry, the situation is good. But if you take the other way around, there is no insurance for dentistry, and then the patient feels very sad. So they will never ever go for the treatment except when the pain hits their
Right.
tooth and jaw.
Yes.
Pain should not be the last module to reach a dentist. It is prevention.
Yes.
And for
Very
that,
correct.
collective responsibility between the dentist and the national dental organizations and government, NGOs, stakeholders, company, industrial partners, everyone's responsibility in oral health sector to increase the awareness of the individuals. And that it has been done. We have seen a stark rise in the aesthetic cases in the last few years. I mean, awareness about dentistry is huge.
Yes.
They had, they are dentists affiliated to government institutions and are working there and giving a primary care. So it has seriously increased. That is directly proportional to the awareness of the patient. Of course, there will be change in knowledge and attitude once this things goes on in a longitudinal basis. And it's really great because insurance comes with that too when a database is strong.
Yes.
No database, no insurance.
So, why does dental care remain financially less protected than many other areas of healthcare? What do you think are the barriers for which dental care is not
See,
as protected and
routine dental care is something like, beautification if it takes into consideration, right?
yeah,
In that way,
huh,
it is not financially protected.
huh.
Okay.
Yes.
But when dental care comes to the organic level, that is the disease level, right?
Yes.
In that way, it is protected. If there's a caries and advanced to morbid condition, I mean, the patient is admitted for dental caries.
Okay.
Of course, it will be covered under insurance. But what's the outcome exactly? The basic management and then the definitive management for the dental caries.
Dental
And all.
care.
That
Yes.
is, I'm just sticking to dental caries as an example because I feel that is a ubiquitous disease.
Yes.
It is happening from all age group. There is no modality of spread. I mean, even dentulousness is the final marker of dental diseases. Often, dental caries is the cause of the disease. But from periodontitis.
Yes. From a dentist perspective, how should we manage a situation where the ideal evidence-based treatment is financially unaffordable for the patient?
See, we have to categorize the patient under emergency or follow-up,
Yeah.
elective or emergency. That's the first point. And for emergency things, we should have a definite slab for the patient, how to deal with the case. For example, if a patient is having a lot of toothache, we can do emergency access opening. Just, I mean, remove the pulp, okay, do the pulpectomy, and we can leave it for a tertiary restoration and educate the patient. This is the emergency treatment we have done. And that is also supported.
Yes, yes.
The database supports that also. In human resource management, also information management system in the as per the structures in the dental arena. We have seen that yes, we can do step by step. We can take. I mean, we are going in that way. It's not the complete RCT. It's the empirical stage and then going for the definitive stage and restoring the tooth.
Yes.
Different stage altogether.
Yes. Levels. But policy interventions such as preventive programs, insurance coverage, mobile clinics, or dentistry can most effectively reduce the financial barriers. What do you think as a
First of all, there's a frugal innovation where we need to increase the awareness of the patient. To be very frank, it's in the public health level about dental health. And specify that uh, the dental health is very indispensable. The smile is an asset. If you have got some dental infection, it can lead to serious body issue. And of course, nowadays, as the idiom goes, there's a bi-directional pathway and systemic and is linked to dental health. These things are going on. And I request at a policy level that, there should be more number of MLPs and it should be trained in dentistry, you know, because dental, manpower is at a declining stage. We have a dentist in the basket, but we don't have the manpower and the auxiliary dentistry staff with us. So that is again a very demanding thing for that.
So from this perspective, my next question will be like from a global arena, what do you think some changes or major suggestions can we give so that this problem of financial barrier can be resolved at
In
a
global
early
arena.
basis? From the perspective global arena.
Global arena, we can stick to the philosophy of WHO, where basic package of oral care should be done to the given to the patient. There should
Yes.
be continuous awareness program. The national programs like National Oral Health Program must integrate. I mean, it has integrated with communicable disease and non-communicable disease program, your maternal child health program. When and there, when we find there's a link between the oral system and connection, we can go through a program at the grassroots level. Yeah. And then it can happen. And frankly speaking, it is not the capacity of a dentist sitting in a clinic. It is the government's responsibility for doing, and they are doing it. No. Our role is to just strengthen and specify that yes, awareness and our level. How it can be identify it, yeah, make it database so that more accessible. Policy workers can get some knowledge. Yes. So coming to the last part of this session, I will be asking you just a simple question. Like from a, as you are a very well practitioner, a long practitioner, and you have seen many patients, and you have experienced all the things. So from a public point of view, what suggestions you will give to the public or the viewers who are watching us? How should how can they decrease their financial barrier and how can they access the major dental care in their life? I will start with the idiom. I mean, two idioms. First in Hindi, brush din mein do minute हर बार. That is the best thing to stay above dental diseases. Yes. Second point is that's the main point. Second most important point is visit a dentist every 6 months. Make a good kith and kin connection with them. Believe in the concept of family dentist. Reach out to your dentist, talk with them, mail them, chat with them. I mean, that will be great for him to understand it. And there should not be no telephonic consultation because that might be because we all know that dentistry is an institution-based subject. So it's like difficult for dentists to give you answers over phone and all. Yeah. But we can go for a screening. Screening is very affordable for us. It's a low cost, effective way of finding out what the difference between the disease and the healthy structures in the mouth. The screening for oral disease is most necessary. One must go for it. And it's easy, we can achieve it by nearby government hospitals, nearby dental clinics based on our pocket size and maintain a database. What is our oral health indices status? Help the organization to maintain a database of the patient coming to them, like a index for the number of caries burden and the caries burden for the patient. I mean, those are reporting in so and so clinic that can be measured, and then we can go for the inventory management also by that. A yes. Dentist is sharply dependent on the inventory management. If someone opens a new clinic, the clinic don't run by itself. He has to give he or she have to give a quality treatment to the patient. For the quality treatment to the patient, he or she have to know what is a baseline dental disease condition in her locality. And then comes what is the reporting pattern of disease to her or his clinic. That way, he or she can improve the dental treatment for the public, and which converted to patients, reaching out to them. In this way, the finance will be cycled and recycled. The planning is an important point because resource allocation is most important. You have a specified fund for a dental clinic. Now I have to invest in my composite veneers cases or I have to invest in my surgical cases. Yes. Or do I need to go for tertiary and quaternary inventories like implants and all gadgets? That depends basically on the capacity of the dentist and of course the turning point is the database what the dentist have regarding this local. Yes. You should know what is the circumference, the radius of kilometer the patient approaching it. Yes. Is this clinic geographically viable? It's not about starting a new clinic or tying up or acquiring a new clinic. It's about understanding the geographical data set of the place that identifies what should be the treatment plan for the public. Yes. That's very important for you. And dentists should also go and do camps, not only just for the sake of publications and in newspaper and some name and fame. It's about measuring dental diseases that will be directly affecting his capacity building and also the database of the area. Of course, the patient will be having a close knit with him or her, and then they will come down to him or her for treatment. That's very really great. But that way, we need to have a socio-dental connection with the patient.
Yes.
It's not a piecemeal approach where simply a dentist will be just
The
doing.
patient will be coming to the clinic and we just treat them and send them
No,
back.
that will never
That will
happen
not
because the human touch is required and human touch should be always there.
Understanding the perspective is also a
Yes,
major
that's
goal
that's
of dentist.
that's
I will say.
simply a dental camp will not do.
No.
What like if I tell you brush twice a day, and that is even written on the very much branded websites, and
Yes.
everyone is doing the same thing.
Ah.
Even I am getting a lot of calls every day. Sir, do you need social media campaign posters monitoring?
Sorry.
See, it's about the poster will speak, the painting will speak. It's not that when the poster is there, it should be definitively speaking to the public.
Yes.
It's not a static entity, right? So these connections can be done. When a dentist really understand the baseline value of the dental diseases in numbers,
Yes.
and then hit it the inventories of his clinic to understand that how to manage the dental clinic. So the finance will be a cycle, planning will be a cycle. So there will be no dissipation of the finance and there will be no burden. Yes. If it is planned properly.
And it should be tailored, like for each patient,
It should be
treatment
tailored.
tailored.
It should be tailored.
I guess that will also decrease somehow financial burden on the patient.
The only burden what we have is we have invested a lot in the clinic by seeing the competition in the market. No, that's not the way. We should invest in our skills.
Yes.
Learn how to do a good treatment, minimum material to be used. I'm not telling the dentist or the fraternity that reduce the charge or take more charge as per the.
That is not a.
That is personalized.
Yes.
Sometimes two other national organizations have got a direct effective role on it, but service is something personalized. One is happy they can charge this much with from the patient, and there can be a capping limit if it is commercialized also. It's completely the individual one-to-one discussion. That's not a discussion in total for us. For us, what is important is the most important. Are we giving the service? Are we delivering the oral health services to the patient in proper way or not?
Yes.
Sitting in a clinic, sitting in a public chamber, or sitting in an institution where is it public health level or clinical level? Population level or institutional level? The concept is that the patient has to get the service appropriate and fitted for the scenario, including the dental scenario. And of course, we are here to measure dental diseases, analyze the data, pattern evaluation of the things, and then go for the best thing. Yes.
For sure. So today we basically know how to just decrease the financial burden and how to plan it and how to explore some areas, and we discussed that points with sir, and let's hope patient and our viewers understood it. So thank you so much for joining with us, and let's meet in the second or third podcast of us. Thank you.
Thanks. Thank you.